My name is Gigi El-Bayoumi, and I'm the founding and executive director of the Rodham Institute, 10 years old, dedicated to improving health equity through education and community partnerships. We have 181 communities. We're located right here in DC. And our website is not up yet because we were at GW and now we've transferred to Georgetown. So please look out for our new and improved website. Well, I am just so happy and honored to be on this panel because we've got some incredible men who are leaders and visionaries and just incredible activists and humanists. I'd like to start by introducing each of them, but I really would, refer you to the program, because if all I did was to tell you their accolades and their qualifications and their accomplishments, we would need the end of the day. So let me start off with you, Dr. Hildreth. Dr. Hildreth is the president and CEO of Meharry. He is an MD and a researcher. His specific area of research and where there were really profound impacts on research was the role of cholesterol in HIV. Welcome. Next is Dr. Gary Darrell, MD, MPH, originally a gastroenterologist. He is president and CEO of Wellpoint, which is the largest Medicaid managed care program in Maryland, correct? Or in the world?
In Maryland.
In Maryland, okay. Well,
it is Darrell.
Darrell, I'm sorry, forgive me. I don't know why I'm... So next is my friend, Dr. Reed Tuckson. And Dr. Reed Tuckson established the Black Coalition Against COVID. And he is also the former DC Health Commissioner, former president of Charles Drew University, former whatever. I mean, he is also on the, he is a National Academy of Medicine inductee. I mean, really, I could go on with all of these gentlemen. So the title of today's talk is, or panel, is Anatomy of Meaningful Change in Health Equity. So all of the people that you see here on stage have not just walked the walk or talked the talk, they have walked the walk. So I would like to start with you, Dr. Tuckson, because you established the Black Coalition Against COVID, and I want you to kind of walk us in a granular way of why did you do that and what was the approach and the model, because really what I hope will happen is that this panel will inspire you and also give you specific models and specific sort of a pathway or a map to implement some of the changes, because these are really exemplars here.
Well, let me go. Thank you, first of all, Gigi. Let me go very quickly. I was, as introduced, lucky enough to be the Commissioner of Health in this city during the height of the AIDS epidemic in the 80s. And in that experience, I learned granularly how important it is to have an organized community engagement to fight such an overwhelming public health threat. That government could not do it by itself. It couldn't be top down. It had to be top down and bottom up, meeting in the middle. Easter Sunday 2020, when we saw the data around the COVID pandemic, we became really well aware of what this is going to mean. And so I went back to, even though I didn't live in the city, but because of everything was closed anyway and you could do Zoom, I called all the community influencers that were part of our fight against AIDS. And that was the returning incarcerated citizen advocates, small business owners, the musicians, the poets. In DC, it's the go-go musicians, which is our thing, yay, go-go. Small business owners, just the faith community, the academic community. We called all the influencers that we could and just simply said, we have got to come together and fight this. No money, no staff, no nothing. But we just pulled together and we started doing stuff out of our own pocket and making it work. I won't go through the details of what we did at community-based organizing, but it became clear that obviously a vaccine was going to be the key, and that meant vaccine clinical trials. And so that meant we had to really now make this a national effort because, of course, the first thing that happened on our first conference call, on our first radio show about this disease, it was Tuskegee. 40 years after we fought the AIDS epidemic with Tuskegee being the #1 watchword, here we were again. And so knowing that we were going to need to have vaccine, that meant vaccine clinical trials. That meant let's get together and call Dr. Hildreth. the president of Meharry. Let's call Wayne Fredericks president of Howard. Let's call Valerie Montgomery Rice president of Morehouse. And all three of those, and and also the leader at Drew. So all four of our black medical schools came together without any convincing. I mean, you didn't have to say, Dr. Hildreth, look, we need you. It's like when and where. And so they all came with the NMA, the National Black Nurses Association, and then our call to blackdoctor.org. And together we were the Black Coalition Against COVID that started to then fight through. I'll conclude by saying that what we were able to do with that, again, no money, no real support, just getting it done by people donating. Dr. Hildreth was on a number of our calls, which was exceedingly important. He didn't have time, but he did it anyway. And so at the end of the day, we partnered with the black fraternities and sororities, the Divine Nine, the 100 Black Men, 100 Black Women. One night we did a conference, we did a town hall with BDO that hit 850,000 African Americans. And that became, and then the last thing we did was to partner with the Black Faith Initiative, Choose Healthy Life, and put that together and move that momentum across the country. So the conclusion is this: stop making excuses. Don't worry about whether you got the money or you don't have the money. Black life is too important to worry about rate limiting steps. If you have the drive and the motivation, you just move forward and you get it done. There were many other lessons, but I don't want to monopolize any more time.
Thank you, and we'll come back to you to talk about some of the specific lessons, but the first thing I heard is getting everybody in the room.
And by the way, Gigi El-Bayoumi was also one of the key people that launched that, and I'm not going to let her get away without that praise.
Oh, thank you. Dr. Darrell, you have both the clinician as well as the research and, of course, the payer side. What do you think that all of those areas, what is the importance of having them in place, and what unique role does the payer play?
Well, I'll just start by saying when we think about advancing health equity, it starts and ends with community. And I think it was Tara who mentioned in the prior panel, we have to come out of our offices, in my case, out of the white coats, and actually step foot in the communities that we hope to serve and impact. And I say that because it's important that we kind of co-design. We can't come in just with our plans and expect that we'll see results. These plans have to be co-designed with the community who are most proximal to the inequities. And so as I think about the journey that you just spoke about of being a clinician kind of on the front lines of the COVID pandemic, we were seeing people come in from the community who were having active symptoms, but catching COVID from their coworkers because they were going into the workplace with symptoms because they could not afford to take time off. Mm-hmm. And so also to go to something from the prior panel, the importance of policy, you all, whether you're clinicians or not, you collect stories all the time. And so as a clinician, I was collecting these stories of people coming in, transmitting COVID to others because they didn't want to take time off. But we took that to city council, and ultimately, fast forward, we got money from the state and the city to actually give people money so that they could safely recover at home. That's policy. But then as I kind of transferred to kind of working then in the payer industry, and particularly initially as inaugural Chief Health Equity Officer for Elevance Health, having the opportunity to advance and impact systems through policy, but also through partnerships, going back to that co-design. And that's what's extremely important. Now, as you mentioned, I get to lead Wellpoint Maryland, which is one of the largest Medicaid managed care organizations in Maryland. We have over 300,000 members. And it's not, going back to what I said before, advancing health equity happens in communities and it happens in homes. And so it's very critical that as we think about this, one of the things we're doing is partnering with community-based organizations. I'll give you an example. There's no mystery that, particularly amongst kids, asthma can be absolutely devastating, not just for their health, but for their education. And we partner with the organization, Green and Healthy Homes Initiative, to actually go into homes, help to educate the caregivers in the homes around asthma, but also arm them with the tools to mitigate the environment. Because one of the most crushing things, I practice as a gastroenterologist, and one of the crushing things for me as a clinician was to diagnose something, have a treatment plan, but then to send the person back into the environment that triggered that diagnosis and have them come back and back and back. And so this is an example with the Green and Healthy Homes of what we're trying to do to mitigate the environment that triggered the exacerbation. So that's just an example, but I'll pause there.
Thank you. And you talked about the importance of really, I would say, not just engaging community, but community is the driver of that bus. We are the passengers. We serve at their pleasure. They're the ones closest to the problem. They often know what the solutions are, but just don't have the resources or the support. I'm just going to tell you sort of one little story. Ms. Cora Berry called me up and she says, I want to mass vaccination Ward 8. There are 8 wards in DC. Ward 7 and 8, it's just feedback. Ward 7 and 8 are the areas which are predominantly African American and unfortunately socioeconomically underserved. And so the model that we used, and this is outlined in the exemplars in the Black Coalition Against COVID, was to train the community-based organization that serves people, because we trained the trainers, because a lot of them, first of all, were reluctant themselves to get vaccinated. And so if they understood the issues, then they are the ones that signed up the 900 people on one day. So I think as we're talking here, and I'll come to you, Dr. Hildreth, is that any group should be, any institution should be focused not on just service, but on making sure that we increase the social, educational, political, and economic capital of said community. So Dr. Hildreth, I mean, you are a researcher, a clinician, a leader. Why was it so important for Meharry to be involved in the Black Coalition Against COVID? And why did you say yes so quickly? Is it because Dr. Reed just did like this?
I doubt that. I think we all have tremendous respect for Reed, so whenever he calls me, I'm going to respond. And in this case, it didn't take much prompting because I lead an organization that was created to deal with health inequities. So back in 1876, when the Meharry brothers gave the $20,000 to the Methodist Church to start a medical department, they did that because at the time, African Americans in the South had nowhere to go to become healers. So our foundational mission is based on health equity and making sure folks who look like us can become healers and be healed. My own personal story is that when I was 11 years old, I came from a small town in the South, one of those typical towns where at the time there's a railroad track, the black folks on one side, the white folks on the other side. There's a hospital in our town, it's a county hospital. But my dad got very, very sick, and I couldn't understand as an 11-year-old why my dad could not go to the hospital and be cured, because that's what hospitals do. So it made me very angry, and short time after that, my father, they assassinated Martin Luther King, who had become my superhero. So I made a decision to become a physician myself. And so my journey started because of unhealth inequity. I'm now leading an organization that was created for that 11-year-old who lost his dad. So when Reed called me about this, of course I'm going to answer. But you know, Nashville was saved by Meharry Medical College. Don't take my word for it. If you go to Nashville and ask the people in Nashville who saved Nashville from the pandemic, it was Meharry Medical College. My students, my staff, yes, it's true. We ran the testing centers, we did the vaccinations for the city, because the for-profit entities in town were focused on their panels, and we decided, well, what about the rest of the people? So we stepped in and we took care of it, and it was a wonderful thing for me to see that finally Nashville recognized there are 2 medical schools in town, not just one. Everybody knew about Vanderbilt, but prior to the pandemic, most people in Nashville did not know there's a second medical school, second academic health science center that happens to be an HBCU.
Hey, Gigi, can I just slip in on this point? I think people need to understand something else about what Dr. Hildreth's role is. All of you faced the same dilemma, and that was when we were trying to communicate with our community about COVID, and particularly about vaccine, it was, how can I trust it? Of course, that was there. And then it was, well, how do you know that it's trustworthy, and what are the science? We were able, over and over again, to have Dr. Hildreth as the example because he was in the room, in the committees. And what this is speaking to is 2 things that we really have to pay attention to. Number one is we have got to have more people like Dr. Hildreth who can be elevated. They have the skills, the research back. He's a consummate research professional, so just know that. I mean, he's a wonderfully published researcher. We have to have more of those folks identify and move them up the policy chain so they can be in the room when this stuff occurs. But secondly, we as an advocacy community have got to demand more that from the federal institutions, CDC, NIH, FDA, we've got to put pressure on them to not only bring folks up, but to visualize them. We've got to publicize that the second in command of the FDA is a black woman. You see, and she's just there new, and the mean evil forces are trying to take her out now because they're scared she's going to wind up going to be the commissioner of the FDA when Brother Caliph leaves. So I don't want to push it any further, but I just want you to really, really understand that I could not sell the message, the truth of the message that I was purveying through BDO and other things if I didn't have Dr. Hildreth in the room, and I can say, no, we are there, and this brother cares desperately about getting it right to save black life. So please push both of those ends of the dyad.
And Reed, I wouldn't stop there. I would say, yes, we got to get folks in the room, but we also have to continue to support as a community those people and those institutions. And so, Dr. Hildreth, I think about the innovative work that's happening at Meharry with the School of Global Health led by Daniel Dawes, and I get to serve on the founding advisory board. We need people in the room and watching online to support that effort as well.
Yeah, well, some of the rooms we need to own, not just be in a room.
Thank you.
We got to own some of the rooms. So I just want to mention a new initiative that we started as an example of this. We are partnering with Regeneron, Novo Nordisk, AstraZeneca, and Roche to recruit 500,000 people of African ancestry and sequence their genomes to create the largest data set of folks of African ancestry in the history of the world, actually. Some of you may not know this, but the first genome was sequenced fully in 2003. It took 10 years. It cost $1.8 billion. And now you can sequence a human genome in 3 hours, 4 hours, at a cost of about $700. So thousands and thousands of genomes have now been sequenced. 1.2% of them come from folks who look like me. So when we start to apply artificial intelligence and data science tools to find new drugs and new interventions, they're not going to work so well for us because we're not in the data. So we decided something has to be done about that. But the beauty of this is we own the data, we'll own the IP. We demanded there be another grant to help us train future minority scientists, become data scientists, artificial intelligence specialists. AI scares me. I don't know about the rest of y'all. But it also scares me because if you look at people doing it, they don't look like us, right? And if they don't look like us, the algorithms that are developed, the drugs that are discovered, they're not going to benefit us. It's the largest study of its kind. It's going to cost $300 million over 10 years. There's never been a partnership like this. And I'm doing my best to help people understand this is going to benefit us. The problem that Dr. Tuckson pointed out about trust, the same thing is true here. So I'm spending a lot of time teaching people what a genome is, what it's not, and how knowing our sequences is going to help our people overall. So we're going to own that room. That's an example of what I'm talking about.
I want to give you, thank you, a specific example of what Dr. Hildreth is talking about, and that comes from Dr. Chapman at Howard University. So Dr. Chapman runs 4 different clinics in the 4 corners of Washington, D.C., and they are for substance use rehabilitation. He observed that the African American enrollees were not responding to the medication in the same way. So did the genetic sequencing, and guess what? People were metabolizing the medication at a much faster rate. So the dose that was required to effectively treat them was about double the dose. So coming back to policy, if the insurance companies don't, if you don't have the research to say, look, people of this, background, or just like we do for people of this weight or gender, need a different dose, number one, but also it helps to reduce the stigma and the judgmental nature of especially our healthcare system. Oh, you see that? They relapsed, instead of saying they never got the right dose in the first place. So that is a specific example of the importance of research. I'm also a medical educator, and I just want to point out that, especially for those of us that are, with the gray hair, you would never see African American male physicians at this number. The numbers since I was in medical school in 1985 have tanked. So throwing the net wide, starting with little kids and making sure that people that look like the folks here, including the younger members, are really looking at making sure the researchers, the clinicians, the educators are there. Because the reason all of these people have credibility is because of their excellent credentials. That is one of the primary reasons that they were invited in those rooms. Can you speak to your role as the president of Meharry? What are some of the things that you're doing? Because obviously your mission is different.
I just want to emphasize the point you made about the vanishing number of black males who are becoming physicians. When I started medical school in 1982, there were 550 or so black men who matriculated that year. If you fast forward 30 years to 2012, I think it was, the number had dropped to 512. Every other demographic had gone up. Black males had gone down. It's kind of stabilized, but my point is there were social factors and other factors that drove those numbers down. If you don't graduate from high school, you can't go to college. If you don't go to college, you can't go to medical school. So it's a pipeline issue. And part of that has to do with stigma, stereotyping, and the bias that still persists in our country, right? My own solution to the problem is, and people wonder why I would say this, we need more black men teaching K through 12.
Exactly.
If we had that, I mean, that would solve the problem. But there's compensation issues, there's education issues, so there's some fundamental things we need to address in all of this. But as I said, Meharry Medical College, we were established to do what you said, to train black folks to become doctors and dentists. We're now training data scientists, public health professionals. To give you an example of our impact, just to brag a little, there are 70 schools of dentistry in the United States. There's a little school in Nashville, Tennessee, responsible for 40% of all the black dentists in the United States. Can you imagine that? So you ask yourself, what are those other 69 schools doing?
Nothing.
That's the real question, right? But I think there's some things we have to do to make the pipeline more robust. And one of my things is to have children see folks who look like them doing these things and know that it's possible for them. So we've adopted middle schools in Nashville for the sole purpose of having my kids, that's what I call my students, having my kids go to those schools so those young people can see them and say, this is possible for me. Mm-hmm. And that's what we're doing.
So before I turn to you, Dr. Darrell, I will just give you a statistic about Washington, D.C. In Ward 8, less than 50% of kids graduate from high school. If all we did was get those kids to graduate, we would add 10 years to their life expectancy. That's just education. So, Dr. Darrell, as somebody who is younger, and maybe the numbers are actually not that good as they were sort of in our time in terms of African American men, what then becomes your responsibility? How do you feel in those rooms?
Yeah, it continues to be a disparity, just as Dr. Hildreth was outlining as far as black men in healthcare and as clinicians as well. I think, as I think about what our role is as Wellpoint and our role as community members, Wellpoint is certainly making meaningful investments with all 4 of our HBCUs in Maryland and really focusing on healthcare and improving the pipeline. I think, too, beyond investment is visibility and presence, being that trusted person in the community. And so showing up in our schools in a meaningful ways, I think, to really complement what you said about, hey, healthcare can look like being a doctor, but it can also look like being a social worker. It can look like being a nurse. It can look like being a medical assistant. And so really meeting with our schools and YMCAs, et cetera, and we partner in those meaningful ways as well. And I'm really excited because Maryland actually has a HBCU medical school that's coming to Morgan State University. And so we are really excited to partner with them on that journey as well. But it takes all of us. It takes the buses and you inviting us to come in and being that partner with us, Tara, such as the work that you're doing in the South. And it takes partners across industry to do the absolute same, is to be that presence and not necessarily sit in what some may call the ivory tower, but to get out of the buildings and step into the communities and really make meaningful connections to enrich that pipeline, whether it's the schools, K through 12, or otherwise.
I think it's also important because we have privilege in this room by virtue of our education and by virtue of our class background. So Dr. Tuckson, one of the groups that was really neglected very early in the pandemic were the garbage workers, right? And it's interesting that Dr. Martin Luther King Jr. was brought up because obviously that was a very important group to him. How did you sort of identify and engage those minorities within minorities, if you will?
Let me, first of all, I'm going to try to be quick and answer that, but I'm sitting here now from the last two conversations, very, 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 not depressed, but angry. We talk about these issues over and over and over and over again. We've had 1 million minority health conferences. We have got to make a decision as a people that it actually matters whether we live or die, period. That Black lives matter. If they do, and they do, they got to matter to us first. I wish I wasn't 73 years old. I wish I was 53. And the reason is this. I mean, I am in my last campaign, and I've got a whole nother campaign. It's a national campaign. I've brought together the entire health ecosystem for the first time in history, 90 organizations that extend from the breadth and depth of every part of healthcare industry, from the basic scientists all the way through to consumers, to fight the issue of mistrust and disinformation, which is a major battle. So I can't do what I'm saying here. But if I was 53, we need a Marshall Plan. Mm-hmm. We need an emergency summit where we bring all these assets together, funded by Black folk out of their own pocket and going to the federal government, every foundation, and we just say this is going to be a meticulously driven, no people but a people can save a people. You got that?
Yes.
No people but a people can save a people. And so we need to find a way to have some leadership, and it's got to be the Congressional Black Caucus, the NAACP, the blah, 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 and the blah, 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 all coming together in a sustained, non-rhetorical effort that does the kindergarten through 12th grade education, and that demands and fights for the local school boards, the teaching of science. The teaching of science. We are absolutely not prepared for mRNA vaccine. Guess that's just the tip of the iceberg. Did you hear what Dr. Hildreth just said about the level of intimacy and complexity of molecular biology that is going to be the standard for medical care? How many kids coming out of high school are going to make probabilistic statistical decisions about their health? Not you have this or you don't have that. The probability of your having this are. How many kids have had a course in statistics? My point being, we are too passive. Now, where we are pretty good at, to your point, is we are pretty good at organizing 850,000 people on a conference call. When you put on the flyer, BDO, with us together, the logos of every one of those organizations, Jack and Jill, Divine Nine, you can hardly see the flyer for all the Black organizations' logos. And that was deliberate because we wanted to make a statement. And those organizations are sitting side by side the picture of Hildreth. You see what I'm saying? Mm-hmm. What we have done, though, our ilk in this room, we have matured and grown economically ourselves. We have moved on up to the east side. When we need to reach our people who are not college educated. Our people that are hip hop kids, when we need to get, who do they listen to? They listen to Kyrie Irving, Flat Earth. They listen to that woman that said that the vaccine, her cousin in Trinidad, and his testicles swelled up. We are not connecting with our own people. We have evolved outside of our community, and we are leaving it to people who want to foster mistrust and disinformation, and that's what we're left with. And by the way, all those athletes who always love Ali, not one of those suckers were willing to violate 1 penny of tennis shoe sales.
That's right.
To come out and say that we need our kids vaccinated. The only ones that did it were the guys that retired. That's where we are. So we had to find the garbage men who had no one to speak to. And so Gigi got out there with them, and they were out there picking up the trash in the middle of the pandemic with no PPEs, no education, everybody's at home, and they out there doing all the dirty work by themselves. And so we had to elevate their conversation. So I'll stop there and just say, listen, folks, we are not serious enough. Number 2, we do not organize ourselves for success. Number 3, we're leaving our kids bereft in their educational system. Number 4, we are advancing ourselves outside of our own community. We're doing just wonderful. Hope y'all make it. And the people that we turn to who can reach them do not care about them as much as they care about whether or not Nike gives them a new shoe.
I want to come back to the role that each and every one of us can have, because we have different and competing priorities, so that if you're younger, you're trying to establish yourself, people that are on the older side can afford to speak up. So I'll give you an example of, on a very sort of granular level, where I had worked, the white women administrators could work from home, but not their black counterparts. That is but one example where calling that out is important. I also want to say the other side. One of our churches, Temple of Praise, the largest church here in Washington, D.C., delivered 3 million meals, not just to their congregants, but to the... Do we hear these stories? It is up to us to publicize these stories, because there are incredible leaders. And if we don't elevate, because you know what? When everybody is in the room, it gets it's tiring, because you're always being called to be on this committee and this. I mean, you have to serve all kinds of things. So there has to be support at every level. I see that somebody wants to speak and no, you're good. You're good. So I think we're at the closing remarks part. Good. So what I've heard as the conclusion, sort of the take-home points, if you will, is that each and every one of us has a role. And that health equity is not just a slogan, just like Black Lives Matter is not just a slogan. We're tired of slogans. We have to translate that into action. We have to take a page from our history, whether it's the National Medical Association, which was created at a time when Black physicians were not allowed to join the AMA. It is important that there is a kind of I'm not a member of the African diaspora, which puts me at an advantage, because I don't have the centuries of enslavement and shackles, which are now electronic. So I don't have that. So being able to remind people of one's history, both relatively modern history as well as older history, I think becomes important.
Can I correct something you said?
Please.
All 8 billion of us, if we trace our origins back far enough, we have African.
Of course.
Right, so just...
No,
just,
I meant African diaspora,
every
special.
8 billion people walking on this earth can trace their origins back
Of course.
to the motherland.
And my Egyptian sister, come on, baby.
Well, not all Egyptians identify, but that's a whole other panel discussion. But the African diaspora, I need to call out that it has the unique, unfortunate distinction of the biggest genocide. I mean, we could go on, but you are special, is what I mean to say. You are special.
I'm not
I know.
special,
You are.
but I live in a country that wants to make me feel like
Yes,
I'm special
Yes.
and being lesser than,
correct.
right? And it's time for us to, anyway.
I know. We can continue this conversation. Thank you. The importance of stakeholders, everybody being in the room, especially those that are the minorities within the minorities and young people. I think sometimes we forget about them wherever they are. And that finally learning from each other and also calling out each other, especially the people that have the means. I think that I would like to thank Dr. Hildreth, which we don't disagree, by the way, Dr. Darrell, and Dr. Tuckson. Thank you for this robust conversation. Thank you, everybody.